Okay, and so for a lot of you then, for 39% of you, it's about the aggregation of information, and that's very valid because there's a lot of emphasis being placed in the market at the minute about, well, you must have an EPR. You must have an electronic way of viewing patient records. Certainly that was from the national program as well's perspective, but what we're saying is that if you want full information about the patient, yep, you've got to have the electronic information, but you must balance that with the paper-based information. And the next one of importance then is the fact of introducing ways for you to redeploy your staff to make better use of the people that you have, because always remember that the people working in your record center, they know your processes, they know how your paper actually works within the organization. So redeploying them, creating an in-house scanning team makes a lot of sense. And then obviously the presentation aspect of Evolve, being able to present that information back to the end user. And that's it for the main presentation. So thank you very much for coming. Does anybody have any questions? And remember that you can ask questions by clicking the little question box in your toolbar. And if we run out of time, we can certainly email back any additional answers, etc. Okay, a question has come in. Do you have any experience of working with a PCT? So several GP practices using DocMan, etc., and how we would get clinical correspondence out to GPs from the EDRM. This is a good example to talk about. Thank you for that question, Robin. This is a good example of where we've been doing some work recently on our electronic discharge module. So the Connecting for Health have a interoperability toolkit, and what we've been doing recently is looking at taking our electronic discharge module where a trust goes in and says what was wrong, what did we do, what medication, and when that form is filled in, there are several options that can happen. One is that we simply send that information via paper. The other is that we send that information, that letter or that discharge information back via secure email to the GP. But with the interoperability toolkit, it's where Connecting for Health is essentially mandating standards where we can then send that information directly into DocMan. And I think it was in April that we were certified against that interoperability toolkit. So there was a lot of testing went on, and we're now looking towards squirting that information directly in. And so again, for those who aren't familiar with Kainos, it goes back to our heritage as a systems integrator. So we've been working for 25 years in electronic document management in the different organizations like financial and local and central government. It's about tying systems together, about getting information from systems and sending information back out to systems. And just checking for any further questions. A question in interface to e-prescribing systems linking to the medical administration record, and that's actually something that we're looking at present with our electronic discharge solution, where the user can go in, and if they have been using an electronic discharge solution, our e-prescribing system, for example, they can pull all of that information back into the discharge form and then send that on to the GP. So that is actually something that we are looking at present.
Colin?
Yes, Sarah?
Hi, can you hear me?
Yes, I can hear you.
Yes.
Yep.
I've got a few questions here, so I don't know whether you want me to start answering some of these questions.
Yep, absolutely.
Okay. Loretta McAlpine has asked, have you got all your records on an EPR, or do you still have some paper records? Have you kept the paper records as a backup, or have you destroyed them? So there's a number of questions there. First thing, Loretta, is no, we haven't got an EPR. We are waiting for Lorenzo Regional Care, so we haven't currently got our own EPR system. As I said earlier on, we are starting to create some e-forms and some sort of electronic documents within the Evolve system. And as far as keeping the records, we haven't destroyed them as yet. They've been moved off-site. We are looking at destroying them, and we're just waiting to get final say from our clinical subgroup. But really, we're thinking about destroying them within the next month. And then the thoughts are that we'll keep them for a month after scanning and then destroy them.
Okay, thanks, Sarah. Sarah, one for you, actually, towards the bottom there, a question from Stuart. If a trust looks to the future to operate a shared service to GPs, can Evolve be used? I suppose from our perspective, from Evolve, absolutely. It comes down to giving appropriate access and then making sure that appropriate security is in place so that GPs only see information that they should see. Sarah, have you anything to add about that?
Yeah, I mean, it's a really good question. We haven't done anything at the moment, obviously, apart from sending electronic discharge summaries. But what we are doing is we Evolve is available over the N3. So anywhere with an N3 link is able to view Evolve. So a number of our clinicians go out to community hospitals, and we've also got a few of them that work from Norfolk and Norwich, etc. So what we do is we give them access to the system so they just type in the URL. When they're at Norfolk and Norwich, they then ask for a password, which is their Ipswich Hospital password, and that will take them straight into the Evolve system. So.
Great. A question in here about sensitive conditions such as mental health, suicide, abortions, probably sexual health as well. We'll come into that. What I would say about from a technology perspective, there are several different layers of security within Evolve. The first one is what I touched on earlier, the fact that we have a VIP or a member of staff, etc., and so we can have break glass. So yes, we will allow you to access this record, but you must specify why you're accessing it. The second one is a more low-level version of security, where we actually say, okay, for records that are sexual health records, you must be a member of the sexual health team before you even see that those records exist. And so if you think about the way that paper is handled at present, sexual health team will hold their own records in their department, and so it's very similar here. So only members of the appropriate team get access to those more secure, more sensitive pieces of information. Question here from Jill. What happens if the computer system goes down and the clinician can't access the notes? What I would say, first of all, is I'll let you touch on this as well, Sarah, from an IT perspective. We keep a very highly redundant copy of Evolve, so you would actually have potentially two Evolve systems, so that if one was unavailable, you would automatically be shown the other one, and we keep them in sync in terms of when we add a document, it's actually added to both systems, so we have full redundancy available. Have you anything to add about that, Sarah?
In the year of Go Live, we've had no episodes of unplanned downtime, so that's obviously we do have replication the north and south end of the trust, as you've already mentioned. I think we had about a 10-minute downtime. It was just a network outage in one of our areas, the maternity block, but that's all we've had. Any other downtime has been planned.
Okay, great. Just actually a point on that, on the whole PCT. We're actually working with a trust at the minute who are taking on PCT delivery services, and so yes, they're having to do a lot more communication and a lot more opening off the records back to the PCT as well. Question here from Mary. How does a record get updated if a patient returns for another episode, if not using online forms? Well, again, that information is added to a temporary folder for that patient and is then scanned in and placed on the system. Where appropriate links exist to the EPR, to the PAS, where we can actually get episode information out of those systems, we can tag the documentation in Evolve as being for a certain episode, so that at a later point a user can then go in and say, well, I'd like to see this information based upon the episodes that it was generated for. So we can tag and separate information based on episode, but it largely does depend on the systems that are available and what episode list, for example, we can get out. Sarah, do you want to say anything about the realization of benefits? So we have a question in there. I'm trying to find it on my list. To what extent are you realizing the tangible financial benefits as identified in the business case?
Yeah. Okay. As I said earlier on, we haven't at the moment. We haven't made up any new case notes at all since November. So obviously there's a saving there. However, within the first year, we weren't expecting to make any savings on staff, and I don't believe we have at the moment. That's simply because obviously what we're running two systems side by side. But as more and more notes get scanned, obviously the forecasted reduction in staffing costs is due to go up. So that's really where we are at the moment. But there's obviously a reduction in paperwork and admin costs. So.
Great. And we're just coming up on the end of our session, so any further questions we'll answer via email. Just one last one. Can Evolve be used on iPads, Android phones, and handheld devices? Yes, it can. You've got a few options. Evolve is completely web-based, so you can open up a browser on those devices and use it. However, we're also looking at specific applications. So, for example, I have an iPad that I use for work, and Evolve is available on that as a native application, so making best use of the device itself. But if there's not a native application available, yes, you can use it because Evolve is a web-based. So the idea is that anywhere that you can get secure access onto your Trust network from a web browser, you've got access to the patient record. And that's us. It's 11:30, so our time has gone. Any further questions we will answer and we will distribute back to you, but I'd like to just say thank you very, very much for coming. If you do have any further questions, you can contact us, our webpage, kainos.com/evolve. If you want to contact the Evolve team, it's evolve@kainos.com. You can contact Sarah as well at sarah.clark@ipswichhospital.nhs.uk. And there will be further webinars in the future, so watch out for those as well. So thank you for coming, and have a great weekend.